Welcome in everyone to our next installment in our Aspire video series, learning all about interesting occupations in health sciences. And we are fortunate today to have Adrienne Hardy with us to talk about being a diagnostic medical sonographer, which
Yeah.
maybe that's a job you heard about, maybe it's a new job title for you. And that's really the point of our Aspire series, is to introduce you to jobs that you may not know were jobs. And
Mhm.
so we're grateful that she's taking time out of her busy day as a traveling medical professional. We'll learn about that too. So, Adrienne, thank you for being with us. And
Yeah,
let's just
thanks for
start
having me.
by defining what is your job? What do you do as a diagnostic medical sonographer?
Well, you could just call me a sonographer or an
Sonographer.
ultrasound technologist.
Okay.
So our job day to day is to use a machine that produces sound waves and pushes the sound waves into the patient to give us back a picture of what's going on inside their body. Ultrasound can look at most anything soft tissue. So, depending on what your specialty can be, you can look at abdomens, thyroids, vessels in the body, the heart, all kinds of parts like that, to give the doctors a better picture of what's going on inside people. So, it's a way to have eyes inside of a person in a way that doesn't hurt the patient. There's no radiation or anything like that. So, it's really becoming a detective to solve a case of what is going on inside
Hmm.
someone.
So is it fair to say that it's a synonymous with ultrasound technician? Is it the same job? Is it a different job because the title's a little different, or is it the same?
It's the same job. I usually say ultrasound technologist
Okay.
because when you say sonographer, people just think of the people who type in courts. So
Yeah,
I say
stenographer.
ultrasound
Yes.
so that way they won't think I'm typing in a court somewhere.
Okay. Okay. So for
Uh-huh.
the purpose of this, it's an ultrasound technician, and and
Or
I think what you
sonographer.
said
Mhm.
what you said previously was, when I think of ultrasounds, I think of pregnancy, because in
Of
my
course.
most of my experience with ultrasounds, it was going with my wife to the ultrasound to see how the
Yeah.
baby's doing. But you're saying that ultrasound, like working in this field, you're looking at various body parts, not just women who are pregnant, but all kinds of people with various ailments. Is that right?
Oh yeah. The span of what you can do with ultrasound is very vast. And that's something that really attracts me to ultrasound because I feel like there will never be a day where I run out of things to learn or new registries to accomplish. I mean, from breast to tissues to invasive procedures where you're helping people drain fluid off of their abdomens or out of their lungs from cancer, to helping a doctor guide them to where a cancer is so that you can biopsy it. To, of course, you can go the OB and GYN route to help women who are trying to get pregnant or who are pregnant to see how their babies are doing, to let them see that heartbeat for the first time. I mean, there's so many routes that you can go with this. And it's a career that is truly humbling because you will always be learning. No one's bodies are the same. No two patients are the same. No day is the same. And
Mm.
as soon as you feel like I'm comfortable and I know what I'm doing, that's the day that you're going to learn something new. And
Yeah. Soon as you think
it's
you got it
also
figured out.
dependent on the person, because every person's body is so different. You have to piece together what your patient's telling you and what you know is normal anatomy and what their family history is and put together a piece of, okay, this is what's happening in their body.
I like that you say it's almost like a little bit of detective work. I think that
Yes.
would, it adds that element of not mystery, but challenge to
Oh
the
yeah.
job. And maybe that's not something students would think about when you think about an ultrasound, but there's so much going on between,
Yeah, and
you
you
and the
definitely
patient.
have a lot of power as a sonographer because it's one of the few modalities that's operator dependent. other modalities like CT or X-ray, you place the plate or you place the patient on the table, and whatever is in their body will show. But with ultrasound, it's a little bit different because I'm the one using my skill and my knowledge to move the machine, to move the probe over the patient, that I can be better or worse as a technologist
That's
to help the
true.
patient. So
Yeah,
it's a lot of responsibility, a lot of being an advocate for the patient and knowing, being really smart. You have to constantly be thinking and really critically trying to examine what's going on, because this is going to be the only picture for this doctor to have.
hmm.
So if you're misrepresenting something and bending a sound wave and making it look like it's a terrible cancer when really it's just nothing, you just have moved the camera the wrong way. Or if something is really good and you make it look bad, or bad and you make it look really good, it can have really harmful effects for your patients. So
Wow.
it's really important and a lot of responsibility to make sure that you're knowledgeable and doing your best every single day, because you may be the only person that touches that patient and gives the doctor a picture.
Wow. Wow, that's really well said. There is so much responsibility in that job,
Yeah.
and it can be very tense,
Oh yeah.
in that room. I want to ask about that in a minute, but first, help
Mhm.
us understand your environment where you work. Are you at a hospital? Are you at a private practice? Where are you, and what does your day look like?
So that's another thing about being a sonographer, is there's a lot of different avenues you can go. When I was doing clinical rotations as a student, I tried out a bunch of different type of facilities, from maternal medicine, where it's high risk OB, outpatient offices, to level one traumas, to smaller hospitals where you only get a few patients a day. There's a lot of different ways you can go, even little clinics that work in doctor's offices where you do the same exam over and over again for kidneys or for OB, those kind of things. So I originally started my career at a level one trauma center in Orlando, Florida, and then did a lot of invasive procedures with that, and a lot of pretty hard stuff to see. Very busy environment.
Sure.
And then I moved now to being a travel sonographer. So
Yeah.
now I
Wow.
work at an outpatient center, which has been a big shift for me and a learning curve. But I really highly recommend traveling, because it's really strengthened me as a tech. I've had to learn a lot of different skills that I didn't know before, and I've met a lot of wonderful women who are incredible what they do, and they really teach you a lot that you didn't know.
So I think students will be interested to know about the travel aspect.
Yes,
So right now you are in Fredericksburg, Virginia,
I am. Yep.
and how long will you be here? How long are you
Mhm.
typically in a city? Are you back in Florida for a time and then back on the road, or in a year? What is it going to look like?
Yeah, so the travel aspect is a big thing that attracted me to sonography when I was first looking. Um, Similar to how travel nurses do, what you'll do is join a company, and then the company will give you, usually there's an app that shows you all of the assignments around the country and how much they pay, what kind of computer systems they use. You'll interview with the different sites and then get sent on an assignment if you both like each other for 13 weeks. And
13 weeks.
so, yeah,
Okay.
and of course that can be extended. It can be longer or shorter. The shorter ones are the crisis assignments where they need someone to cover for 2 weeks or something like that. And, some of the contracts are 26 weeks. So, I mean, you sign on, you know what you're signing on for. And they give you a relocation fee. You go and stay in a place for a certain amount of time, and then you move on. So it's been quite an adventure and a really interesting way to do sonography.
Where else have you been?
This is my first travel assignment.
Oh,
I just
okay.
started in January.
So you're like 3 months in. So 13
Hmm.
weeks is like, a quarter of the year.
Yeah,
So
I
are you
already
going back?
extended though because I really like it here. So I'm here till
Okay.
May.
So you're
Yeah,
staying like maybe into the summertime in
yeah.
Fredericksburg. Are you able to
Mhm.
get back home on weekends, or like
Oh
what's the
yeah.
pace?
So So it just depends on the assignment you take. You can do 312s, 410s, overnights. I'm currently on 5/8 because I'm at that outpatient facility.
That means five
Um,
days a week, 8 hours a day.
yes, sir.
Okay.
Yep. So for me, I have a few days built in that I've asked off. But really, the beautiful thing about travel sonography is its ultimate freedom. You know, I have a girl that I work with who's also a traveler. She works 6 months out of the year. So she'll take a contract, take 2 months off, take another contract, take 3 months off, go home, go travel all over the world, you know, whatever you want to do. And just you have to be smart with your money for those in between times because you're not getting paid. But it's a really good opportunity to travel around the country or even around the world in a way that you're still having income,
Wow. Is
which
it
is something that
true?
really
I'm sorry, go
attracted
ahead.
me.
Go ahead. I'm sorry. What'd
Yep.
you say?
Oh, I said that's just very attractive to me because I've only ever lived in Florida prior to this. So for me, it was a good way to try out different states and see where I would want to end up and live in a way where I wasn't concerning my parents that I don't have any money.
Right.
So
And isn't it
it just,
true? I feel like I've seen it on social media. People do like travel nurses get paid more than if you were working in one place, because there's, it's more risk, I suppose, or just more challenging to go move somewhere. They're willing to pay more for
yeah.
travel nurses, travel medical professionals. Is that what you've seen?
Yes, that's definitely accurate. And I had always thought as a full-time staff member that was a little unfair. But now that I am a travel sonographer, I kind of can understand a little bit more, because it's can be a little bit jarring to just move your whole life and be living. You know, I have my car full of stuff and I'll take it to the next location. So you're starting over every 3 months. You know, new friends,
Yeah, that's
a new
hard.
gym, a new work location, which can be really stressful to try and manage your coworkers and you know, work together in a new environment, learn all new computer system, new radiologists.
Yeah,
um,
wow. I mean, wouldn't it take
yeah,
a good, like by the time you get everything figured out, it's time to leave again.
right. Yeah, so it can be a little bit stressful and hard.
Yeah,
So
that's
I
I
can see why they do pay more.
yeah,
Yeah,
I
and
get
you
that
also don't
too.
really know what you're getting. You know, you're going to a place, and I love ultrasound girls. I think that I've had great teams that I've worked with, but you also don't know what kind of place you'll be placed in, and it can vary. You know what they're expecting you to do, um, and it's hard on your body. You know, so it can be really hard if you're pushed to do more patients than your body's willing to do, or work at faster paces than what you're used to. So you just have to be highly adaptable, not only as a traveler but as a sonographer in general, and be really willing and open to learn from people, learn from your coworkers, and always take what's given to you
Yeah.
and make the best of it.
Wow.
And that's big advice I would give to a student is don't ever turn an exam down. You'll be in clinicals and they'll ask you to scan something you've never scanned before. Don't say no. Go in there, mess around with the machine, take some pictures that make no sense to you, because it's better to have something to turn in and to have the sonographer see that you're trying. We want to work with someone who's trying, who's really putting themselves forward.
Hmm.
And it might be a terrible picture and make no sense at all, but at least it gives us something to work with where we can say, all right, here's what you did wrong, here's what you did right.
That,
So
that's
don't ever turn something down.
that's great advice, and that's a good segue into what I wanted to also discuss, which is the communication skills and the soft skills that come with this job. You just gave one great example of,
Mhm.
like, take on every challenge, don't say no.
Yeah.
When I think of the work that you do, and I just had to take my son for an ultrasound a couple months ago, and I think that the sonographers have the greatest poker face in all of medicine, because you're looking at the body. Someone's only in there because something may or may not be wrong. You wouldn't just go in there just for fun. And so
Mhm.
you're taking pictures and you're very, very sort of stone faced. You're not
Yeah.
letting on if something is concerning or not. because you don't want, that the person sitting there is reading your body language and like
Uh-huh.
trying to decipher what you're seeing. How do you manage your emotions in these rooms where it can be very tense or a lot of anxiety from the patient?
Yeah, it's tough. I mean, that is a big challenge to this job. There's definitely days where I leave the room and cry because what I saw was so sad. Or, you're with people on their best and worst days. They've been trying to get pregnant, they're finally pregnant. You're with them when they're finally pregnant and the baby is passed.
Mm,
It's horrible things that you see, but you have to remember at the end of the day, we're not doctors. So, therefore, final medical diagnosis cannot come from us. We have to provide a great picture to prove a point and a story, but it's not on us to make the call. And legally, we're not allowed to say what's going on in a person's body. So I think a big part of you have to be calm and comforting in the same way of not revealing anything. And that's a really hard,
yes,
delicate
that is a
balance.
very hard line to walk.
Yeah, where you have to make the patient feel comfortable and feel like it's okay, everything's going to work out, but in the same way, I can't really tell you what's going on. So, yeah, you have to have a very uh, comforting, maybe just a nice smile, but that doesn't show anything. And I think masks have
Ugh,
helped a little bit with that, right? But yeah,
yeah,
you're
that's
right.
true.
It is super hard, and at the end of the day you have to just be a calming influence in that room, which can be so difficult on some days. And I mean, there's days where it's takes all that you've got. I mean, you'll
Ugh,
hear a grandma talking about her grandbabies and how excited she is to raise him while you're seeing her terrible ovarian cancer that means she won't make it more than a few months. There's horrible things you see, and that's kind of a challenge, but also a beauty of sonography is that you get to be there with that person in that moment. So you really have a big responsibility of making the person feel like it's going to be all right.
wow. When you were going through your training, your education, your training, and you're
Mm-hmm.
learning just how to use the machines, how to take the photos, are you also discussing what we just talked about, like the human side, that bedside manner, that calm and comfort, even though you may be looking at something very serious? Is that discussed in your training? Are
Oh,
there
most definitely.
okay?
The sonographers, if you go to a site that has clinical, which I would highly recommend choosing a school that is A, accredited, and B, has a large clinical component. A lot of schools are online only, which you can learn ultrasound through the textbook. However, I believe that you having the hands on the machine, having the hands on the patient is the best way to learn.
Hmm,
Because you're not going to be able to actually perform the job straight out of school without those aspects. So in clinicals, you'll watch the sonographers a lot and kind of learn different tricks and methods of how they talk to patients that don't reveal much, but also help calm them. One of my professors used to say all the time, you'll learn as a sonographer, to look at someone up and down and get a complete picture in like a matter of seconds. And then also to be able to just be this calming influence. So you
hmm,
definitely, that's a big part of clinicals, and they'll watch you as a student to see how you interact with the patient. Make sure that you're compassionate, because those clinicals are your job interview. You're proving that you're capable, and by capable I don't mean that you're the best scanner ever, but just that you are capable of learning and growing, and that you can perform this job well. And part of that is definitely your patient care. You're there for the patient, you're not there for yourself.
wow.
So you need to make sure that you're taking care of those people.
Thank you for that answer. Because again, like with our company, we focus a lot on those soft skills, those people skills, and how they find their way into the workplace. And in your
Mhm.
job, it's like as important as any. I mean, it's one, we're all are out there providing a service to a customer, but when you're
Yeah.
providing, insights into their health. It's like another layer of like you have to be on your game,
Mm-hmm.
like few other jobs. So I think that's really important for students to hear. And I also wanted to ask you, like, if students are watching this in high school, what are some classes you'd recommend they take to
Mm-hmm.
prepare for going to school?
So getting into ultrasound school can be pretty challenging. Usually the schools are very small and very competitive and
Mm,
mostly women, not meaning that boys aren't allowed. However, with the large OBGYN aspect of ultrasound, I think that general ultrasound can be kind of difficult for men, not impossible. And there's definitely other avenues that I see more men in, like echo for the heart or vascular for the vessels in the body. But I would say as a student, there's a big aspect of physics and also anatomy that you
mm,
need to know to be a sonographer. I didn't know the physics part before going into school, but that learning about how sound waves work, how refraction, reflection, and kind of the how that plays into medical, like how the chemistry of your body and your body's composition works out. You also need a really good mental map of anatomy. um, I would say my mom is a RN, a nurse. And so all the time I would talk to her when I was in school about the different vessels in the liver or the kidneys collecting systems, these kind of things. And she wouldn't know too terribly much about the vessels. And it always confused me. But I kind of realized that it's just a difference in the medical specialties, right? She can administer medicine, she knows about different dosages. For me, it's very important for me to know which direction to go in someone's body to get to a different organ,
mm.
or pathology processes, understanding what certain pathologies look like, what normal looks like, and what result they'll have on your body. So if they have this certain condition, this is what it will look like in the organs. So anything you can learn that helps you with anatomy or medical, I think will definitely help. Also, if you can try and take some communication courses, I took a um, professions of caring course, which was helpful. That just kind of taught you about how to talk to patients, how to be with people who are grieving. Is a big part of being with grieving or sad people. So the more comfortable you are with that, I think it will help as well.
Great. That's great stuff. Because I think you've just given a great inside look at the job. I think the
Mm-hmm.
travel aspect is interesting. Just another layer the students again may not know is even available to them.
Right.
Is it possible for students to ever like shadow to come and observe or like could someone ever stand next to you and watch what you do as a student?
Oh yeah, most definitely. And I would highly recommend it actually because I think a lot of people don't understand what all a sonographer does. A lot of people think we just take pretty pictures, and then they're pretty heavily disappointed when they've worked really hard to get into a program and they realize that the day to day is messy. I mean, there can be days where you get bodily fluid on you. There's days where you're seeing a lot of blood. So I think I would definitely recommend to try and get in and shadow a sonographer to see if the day to day is something you like. Now, if you shadow a place and you don't like it, know that there's other avenues, meaning someone could shadow me at my level one trauma job
Right.
and see the blood and the gore that I would see on a daily basis and how sick the patients I was taking care of and think this isn't not for me. And I wouldn't say that sonography is for the faint of heart anywhere. You have to be a strong person. However, you can go into outpatient or somewhere where the patients are walking, talking, coming into your exam room, and it's a little bit of a different experience. It's not going to
Yeah.
be people who can't breathe, who are on ventilators, um, and those kind of situations. So there's some variability in how gory, for lack of better word, your job can get. But in general, you have to be a strong person. You have to be a patient person, and someone who's willing to work really hard, because you're part of a team, and all of you have to work together to get your job done. And it, you're only as strong as your weakest team member, you know. So if someone's not willing to get dirty there, the whole team is going to feel it, and it's going to be really hard.
Wow. Um, Such good insights. I really am excited for students to hear this conversation because you just painted
Good.
such a great picture of what it is, just
Yeah.
honestly what it is,
Yeah.
and like
It's
the students who
stressful
want
and
it,
beautiful,
right,
and
right, all the emotions
yeah,
and
yeah,
all the skills. It just brings everything to the surface to do it well every day, and so
yeah. I truly love it. It's a great field. No day is boring, and it always challenges me and excites me. I get a little bit sad when I don't scan for a little bit of time and think, oh, I'd really like to see in some organs, as weird as that is. But it's an amazing field, and I am someone who couldn't work 9 to 5 in an office. I would get bored, just sitting there at a desk. So this is a really great way where you can interact with people, hear people's stories, and then kind of send them on their way. It's not like you have them for 12 hours,
right, right, right.
um,
They kind of
and you
come
get
in,
that
they
face to
pop in, and
face.
they're with you for 10
Mhm.
minutes, 20, 15 minutes, and then they're back to, on their way, on their medical
Yeah,
journey, wherever,
yeah.
whatever comes
But
next.
of course, weigh that in with, you got to be a good time manager. You got to be really good under stress and in hard situations. And you got to be smart. You got to think fast on your feet.
Awesome. Uh, well, we appreciate your time and hope you have continued success on your travel journey, wherever the road might take you. And
Thank
thank
you.
you for spending some time with us to tell us about your job. And I know the students will appreciate it. So thank you again, Adrienne.
All right. Thank you for having me, and good luck on your ultrasound journey. Happy scanning.